Assalamualaikum and a very good day to our respected lecturer Miss Jamhira Abdullah and to all our fellow friends. My name is Suraya Jasmine and today our group will be presenting about Malaysia's National Strategic Plan for Mental Health Policy. Firstly, according to the World Health Organization 2004, a mental health policy is an organized set of values, principles, and objectives designed to improve mental well-being and reduce the burden of mental disorders. In Malaysia, the National Mental Health Policy was introduced by the Ministry of Health in 1998. This policy also aims to support the nation's goals of achieving a mentally balanced and a healthy society by focusing on promoting mental health and preventing psychological disorders. In addition, a mental health policy also provides a structured strategy that is implemented through various plans and initiatives to strengthen the country's mental health system. Again, according to the World Health Organization 2005, such policies can help to improve the accessibility of mental health services, promote community-based care, and also enhance the quality and organization of service delivery. Now, let's look at the first problem, which is the rising prevalence of mental health issues in Malaysia. According to the National Health and Morbidity Survey 2015, around 29.2% of Malaysians aged 16 and above had suffered from mental health problems. This is a major increase from only 10.7% in 1996. That means almost 1 in 3 Malaysians today experience some form of mental health challenge. When we look at teenagers, the numbers are even more worrying. The 2017 Adolescent Health Survey found that about 18.3% of teens reported depressive symptoms, 10% had suicidal thoughts, and 6.9% had attempted suicide. These figures have all increased compared to 2012. This clearly shows that mental health issues are becoming more common, especially among youth. It also tells us that Malaysia needs stronger early prevention programs, more mental health awareness campaign, and better support system in schools and communities. The second issue is the shortage of mental health professionals and the ongoing service gaps in our healthcare system. According to the National Strategic Plan for Mental Health 2020 to 2025, Malaysia has only one psychiatrist for every 100,000 people, which is far below the World Health Organization's recommendation of 1 per 10,000. This shortage means that many Malaysians, especially in rural areas, have very limited access to mental health care. Apart from that, there is also the issue of stigma and low mental health literacy. Many people still misunderstand mental illness and view it as a personal weakness instead of a medical condition. This causes discrimination, social isolation, and hesitation to seek professional help. Because of these problems, the effectiveness of the national mental health policy is reduced. Thus, many individuals continue to suffer in silence without receiving the help that they really need. Next, the final policy problem is funding limitations. According to the Ministry of Health, only 1.3% of Malaysia's total health budget is allocated to mental health programs. This is significantly lower than what the World Health Organization recommends for effective mental health system. When funding is this limited, it will affect many areas. The government will also be struggling to hire and train more professionals, build or upgrade psychiatric facilities, and also develop community-based programs that focus on prevention and early intervention. Because of these financial constraints, Malaysia still relies heavily on hospital-based treatment instead of providing community-level services. This will limit access to care and prevents long-term recovery for many people. That's all from me. Now I will pass it over to Amrisha to continue. Thank you.
Assalamualaikum and hello to everyone. My name is Nur Emrisha Fatiha binti Najful Azran.
Thank you, Suraya. Now, I will present to you regarding the objective of this policy. The main objective of the National Mental Health Policy in Malaysia is to improve the overall mental health and well-being of everyone in the country. This policy serves as a clear guidance for the government, healthcare providers, and community organizations to plan and implement effective mental health programs. It aims to make sure that every citizen, regardless of background, has access to proper mental health support. The policy also highlights how important it is for families and communities to play a role in supporting those who are struggling with mental health issues. By doing this, it promotes a caring environment where people feel supported instead of isolated. Overall, this policy shows Malaysia's strong commitment to building a mentally healthy nation through collaboration, awareness, and accessible care for all. The second objective of the National Strategic Plan for Mental Health 2020 to 2025 is to strengthen mental health services for groups that are more at risk, such as children, teenagers, indigenous communities, and those who are facing social economic difficulties. This plan focuses on early detection and quick intervention through community-based programs and regular mental health screening. We also encourage the use of psychological tools to identify signs of stress, anxiety, or depression early so that people can seek help before their condition worsens. The plan also includes initiatives like regular autism screening for children and training teachers to identify learning and attention disorders. Apart from that, it highlights the need for cooperation between healthcare providers, schools, and community leaders to make sure that everyone who needs help can get. By improving awareness, prevention, and accessibility, this policy reflects Malaysia's continuous effort to create an inclusive and responsive mental health. The third objective focuses on strengthening psychiatric care and expanding community support for people living with mental disorders. This part of the policy ensures that psychiatric services are available and high in quality at every level of healthcare, from local clinics to specialized hospitals. It promotes a patient-centered approach that goes beyond hospital treatment by including rehabilitation and recovery support within the community. The goal is to make sure patients can continue to receive care even after leaving the hospital. The policy also supports collaboration between hospitals, community health centers, and social agencies to provide holistic care that covers both medical and social needs. Training for healthcare workers, counselors, and volunteers is also emphasized so that they can help provide early intervention and continuous follow-up. In addition, this policy promotes public awareness to reduce stigma and discrimination toward individuals with mental disorders. Through this effort, Malaysia aims to help patients regain confidence, lead meaningful lives, and reintegrate successfully into society. Lastly, the final objective of the National Strategic Plan for Mental Health 2020 to 2025 is to integrate mental health and Malaysia's overall healthcare system and social development. This means ensuring that mental health services are not treated separately but are included at every level of care, from community clinics to hospitals. It also focuses on training healthcare professionals to identify, manage, and refer patients with mental health issues effectively. Beyond the healthcare field, the plan promotes collaboration with other sections such as education, employment, and community development to raise awareness and reduce stigma. By doing so, it encourages more social inclusion for people who experience mental health challenges. This holistic and human-centered approach shows that Malaysia views mental health as an important part of national growth and social well-being. It highlights that taking care of mental health is not just about treatment, but about building a healthier, stronger, and more supportive society for everyone. That's all from me. Now I will pass to Isa to explain about policy strategy. Thank you.
Hello, my name is Nur Izzah Mulfika binti Abdul Izam. Thank you, Amrisha, for your explanation. Now, I will explain about the strategy. The first strategy is enhancing governance and regulatory framework. This part focuses on how the government plans to make our mental system stronger, fairer, and more connected. The idea is to make mental health a national priority so that all ministries and agencies is not just a Ministry of Health that work together to support people's well-being. To To achieve this, the government will form an inter-ministerial committee to coordinate national efforts and make sure mental health is included in all the government plans. At the same time, the Ministry of Health will set up a joint technical working committee to improve teamwork between hospitals, clinics, and other agencies that provide mental health services. The government also plans to review and update older laws, like the Mental Health Act, to better protect the right of people living with mental health conditions. A big step forward is the decriminalization of suicide attempts and drug addiction, which means people facing this issue will be treated with care and support, and not punishment. Lastly, political and community leaders will be encouraged and trained to talk openly about mental health, helping to build a more understanding and supportive society. And then, the second strategy is strengthening mental health surveillance system. This section focuses on improving data, information, and research about mental health in Malaysia. By having better data, the government can truly understand what's going on, identify which programs are working, and make changes where needed. One of the main strategies is to monitor mental health issues like suicide, depression, anxiety, and schizophrenia more effectively. To do this, the government will develop a central database system that collects information from different government agencies and NGOs. Important databases will such as the National Suicide and Fatal Injury Database, National Mental Health Registry, and National Registry of Deliberate Self-Harm will be upgraded so that the data is more complete and accurate. The Mentari IT System Phase 2 or MIT2 will also be improved to help manage mental health services more efficiently. Besides that, the government wants to ensure that policies and programs are based on real evidence and research so they are more effective and meet people's actual needs. More research will also be encouraged in areas like addiction, workplace stress, and maternal mental health. In short, this section is about building a smarter, data-driven, and responsive mental health system that truly helps individuals and communities across Malaysia. The third strategy is to ensuring the availability and accessibility of comprehensive and quality mental health services. This part focuses on making mental health care easier to access, more affordable, and high quality for everyone, no matter where they live. The government plans to strengthen services at all levels, from small community clinics to major hospitals. They will also improve early detection through tools like e-mental screening apps and better autism assessment tools so that people, especially children and teenagers, can get help as early as possible. Mental health services will also be brought closer to the community, meaning people can seek help at regular health clinics instead of only hospital. This helps to reduce stigma and make it easier for people to talk about their mental health. Special care services will also be developed for women, children, people with disabilities, the Orang Asli community, migrants, and those in prisons. Hospitals will be upgraded with more psychiatric beds, CT machines, and access to special medicines and therapies. Every state will have specialist psychiatric services, including experts in child and adolescent care. To make treatment easier to access, the government will work to remove barriers like distance, cost, and stigma. Mentari centers, also known as community mental health centers, will be expanded to include outreach programs, home care, and job support through the Restart program, a partnership between SOSO and the Ministry of Health. This program helps people with mental illness to return to work. There will also be a national insurance for mental health to make treatment more affordable. Programs like the Optimal Health Program will promote overall well-being, and efforts will made to improve psychotherapy services so everyone can get the care they need. So, overall, this section aims to ensure no one is left behind when it comes to getting mental health support. And the last strategy is establishing and nurturing intra and intersectoral collaboration. This part is all about teamwork, where to build strong partnership between different sectors like government agencies, school, workplaces, and communities. The idea is that everyone plays a role in promoting good mental health, preventing illness, and supporting recovery. Under promotion, continuous mental health education will be provided to all agencies to raise awareness and help people see mental health as the normal and important part of life. For prevention, programs will be introduced to reduce the risk of mental health problems. For example, future married couples will learn how to manage stress and handle conflicts. Married couples will be offered pre-divorce counseling, and retiring staff will also receive a guidance on how to cope with life after retirement. Mental health awareness will also be promoted among students, employees, community members, and religious leaders to create a more supportive society. And then, in terms of early detection, children and teenagers will be screened using age-appropriate tools. COSPEN volunteers will help with community screenings, while JACWA staff will be trained to use the DAS tool, which stands for Depression, Anxiety and Stress Skill, to help the Orang Asli community to identify early signs of mental distress. So, lastly, the rehabilitation strategy focuses on helping people who are recovering from mental health to smoothly return to their communities and workplaces. This will be done through collaboration between different agencies and clear referral system to make sure they get the right support. And that's all from me, and I will pass to Shahira. Thank you.
Hi, my name is Nur Shahira binti Muhammad Mazlan. Next, I will be presenting the policy evaluation of Malaysia's National Strategic Plan for Mental Health Policy, focusing on its strengths and weaknesses based on policy problems and objectives. Let's begin with the strengths. One of the key strengths of this policy is its focus on strengthening psychiatric care and community support. The Ministry of Health's Mentari centers have played a major role in improving access to mental health services. These centers provide rehabilitation, early treatment, and outreach programs, especially for people in the community who might not have access to hospital care. Although some rural and low-income areas still experience shortage, Mentari has helped bring mental health services closer to at-risk groups. Besides treatment, Mentari also focuses on community awareness programs which help improve mental health literacy, encourage and early diagnosis, and reduce stigma about mental illness. This is important because stigma has long been one of the biggest barriers preventing people from seeking help. The second strength is the integration of mental health into general health care and social development. The policy aims to make mental health part of overall healthcare and community well-being. This can be seen through the expansion of Mentari Center, the release of the Community Mental Health Center, implementation on Guidelines 2nd edition, and the implementation of MITS 2.0, which improve data and service management. Currently, there are 28 Mentari centers nationwide, showing the government's continuous effort to expand services. Additionally, the UNICEF Country Report 2022 highlights that Malaysia has made progress in integrating mental health support into schools, family, and community environments. This shows that Malaysia is moving toward a more inclusive and accessible mental health system where care is not only hospital but based on also community-based. Next, the first weaknesses is related to the policy objective of improving national mental health and well-being. Despite various efforts, the data shows that mental health problems have continued to rise. For example, the prevalence of mental illness among adults increased from 10% in 1996 to 29% in 2015, according to the Ministry of Health. This shows that the policy still lacks of measurable impact and clear target to reduce prevalence. Without specific goals, it's difficult to track whether national mental health is truly improving. The second weakness is the rising trend of depression and suicide, especially among young people. The UNICEF 2022 report noted an increasing mental health burden among children and teenagers. In addition, a research made by PILI 2022 shows that suicide cases increased by 81% from 631 cases in 2020 to 1,142 in 2021. This shows that mental health stress worsened during the COVID-19 pandemic due to long-term stress, financial difficulties, and isolations. One key reason for this problem is insufficient funding. Currently, only 1.3% the national health budget is allocated to mental health, much lower than the World Health Organization recommendations. Because of this, Malaysia faces difficulties in hiring and training professionals, expanding community-based services, and running prevention programs effectively. The third weakness is the unequal service distribution and shortage of mental health workers. According to the National Strategic Plan for Mental Health 2020 to 2025, Malaysia should ideally have about 3,000 psychiatrists for every 10,000 people. However, as 2022 research made by Sulin, there were only 479 psychiatrists nationwide. This means there are serious human resource shortage, especially in rural and remote areas, making it harder for people to access proper care. Thus, the policy's ability to address the growing mental health issue is limited by underfunding and insufficient workforce, which directly reduce service accessibility and effectiveness. In summary, Malaysia's National Strategic Plan for Mental Health Policy has made real progress through Mentari centers and community integration. However, limited funding, workforce shortage, and rising mental health issues counter to weaken its impact. Stronger investment and clearer targets are needed to make the policy more effective and accessible for all Malaysians. Thank you.
Assalamualaikum and hi everyone. My name is Nur Hidayah binti Jamsari. Now, I will continue with the policy recommendations. First, we recommend strengthening policy goals, monitoring and research system. Currently, the mental health policy has a broad objective but lacks clear measurable indicators. So, the government should set smart targets such as reducing adult mental disorder prevalence from 29% to 20% by 2030. To ensure accountability, progress reports should be published regularly at both national and state levels. We also propose a centralized mental health data system to collect real-time information from hospitals, schools, and enforcement agencies. This will enable more effective evidence-based decision-making and allow the government to respond faster to mental health trends. The second recommendation is to increase funding and strengthen the mental health workforce. Mental health currently receives only 1.3% of the total health budget, which is much lower than WHO recommended 5%. Because of this, many services remain limited and understaffed. Malaysia only has 479 psychiatrists nationwide, which is far below international standards. So, increasing training capacity and providing incentive, especially for services in rural areas like Sabah and Sarawak, is very important. Upskilling primary healthcare workers can also help provide early intervention and reduce treatment delays. The third recommendation focuses on enhanced community-based services and multi-sector collaboration. Many people in rural areas still face difficulty accessing mental health care, so mental health screening should be integrated into clinics, schools, and workplaces to support early detection. Partnerships with NGOs and private sectors can increase community support programs like peer groups, school counselling, and workplace mental health initiatives. We also need stronger campaigns to reduce stigma, supported by agencies such as the Ministry of Education and Ministry of Women and Family. This will encourage more Malaysians to seek help early. To conclude, These recommendations directly address the weaknesses in the current policy by improving governance, funding and community support. Malaysia can build a more inclusive and resilient mental health system. In conclusion, Malaysia has made significant progress through the National Strategic Plan for Mental Health Policy, especially in expanding community-based services such as the Mentari Centres. However, mental health challenges in our country are still increasing. Mental health cases continue to rise, and issues such as limited funding, where mental health only receive 1.3% of the total health budget, and workforce shortage with only 479 psychiatrists nationwide remain major obstacles. Public stigma and a lack of awareness also discourage many people from seeking help. Therefore, strengthening governance, improving funding and expanding the mental health workforce must be key prioritized. At the same time, Malaysia should enhance early intervention through mental health screening in schools and workplaces and develop more digital mental health services like telepsychiatry and mobile counselling to reach rural and undeserved communities. With strong cooperation between government agencies, healthcare professionals, communities and families, Malaysia can build more inclusive, accessible and resilient mental health system that ensure the well-being of all Malaysians. That's all from me. Thank you.
The first question is from Group 1. Among the policy objectives, the most difficult to achieve is through improving national mental well-being because it requires to change people's mindset and culture. Reducing stigma and encouraging openness about mental health takes time and strong cooperation from school, workplace and community.
The answer for question from Group 3 is the policy promotes early screening in schools, counseling program for students, and stress management at workplaces. It also encourages collaboration with NGOs and community groups to spread awareness and provide peer support.
So now, I will be answering the last question from Group 4. What are the biggest barriers preventing this policy from being fully implemented across Malaysia? I think because the main barriers are low funding, which is only 1.3% of the health budget, shortage of trained professionals and lack of awareness. Moreover, without enough resources and staff, it's hard to expand services equally across the country. And this will be my answer.
Thank you, Group 5, for the question. Mentari has been quite successful in improving access to care, especially in cities. It offers counseling, therapy, and outreach programs that help people get early support.
That concludes our group presentation. We hope the information shared today has helped you understand the current issues and improvements needed for Malaysia's national mental health policy. Thank you.